Hello everyone, I am Dr. Nikhil Choudhary. I am a cardiologist at Narayana Multi-Speciality Hospital, Jaipur. Today I want to discuss one very important thing with you. It is a very important risk factor leading to heart attacks and heart disease, and that risk factor is dyslipidemia. So dyslipidemia basically means abnormal lipid profile. We all know a lipid profile is a test which we get it done to know the amount of cholesterol in our body. And ideally the lipid profile should be done the sample should be a fasting sample after an 8 hours fasting duration. So it should be done early in the morning. It's very important because once you have eaten something and you get the lipid profile done, it will come out to be deranged. So a lipid profile basically has 4 or 5 values. The first value is the total cholesterol. Other than that, the total cholesterol is composed of different components. They are the LDL cholesterol, which is the low density lipoprotein cholesterol, the HDL cholesterol, which is the high density lipoprotein, and the triglyceride levels. We also have a VLDL level, which is again a very low density lipoprotein. Practically, for all practical purposes, the important values which you need to see are the total cholesterol, and ideally the total cholesterol should be less than 200 milligram per deciliter. The LDL cholesterol, which we also know as the bad cholesterol, is the LDL cholesterol, and ideally it should be less than 130 milligram per deciliter. Someone who is diabetic or who has pre-existing heart disease or has had an heart attack, the LDL cholesterol should be less than 100. Triglyceride levels are importantly, especially in the Indian population, we have more of a high triglyceride levels. And triglycerides, basically it should be ideally less than 150. But a lot of times, especially in Indian settings, we have more of insulin resistance, more of diabetic population, and our triglyceride levels are high. So we don't need to panic unless the triglyceride levels are more than 250. Ideally, we initiate treatment whenever the triglyceride is more than 400. But anything more than 250, along with other risk factors like hypertension or diabetes, it also warrants treatment, especially in our setting. Then HDL cholesterol, which is the good cholesterol. Again, we have more of a, as an Indian population has data has shown, especially a Jaipur Heart Watch study was done, which showed that HDL levels are less in our country, in our population. So HDL cholesterol is the good cholesterol, and ideally in males it should be less than it should be more than 45, and females should be more than 55. So this is what basically dyslipidemia means. So any abnormal value of these components which I have described is called as dyslipidemia. And so what happens is when the blood LDL cholesterol levels are high and the HDL cholesterol levels are low, this cholesterol basically gets deposited in our coronary arteries or the arteries which supply blood vessel to our heart. And whenever this abnormal cholesterol deposition causes blockages, which can lead to further heart diseases like angina or heart attacks. So that is why we need to very carefully look at our lipid profile, and if things are not right, we need to consult a specialist. So there are various treatment options whenever someone has dyslipidemia. Data has shown that the majority of benefits which we get are from a medicine or class of medicine known as statins. Most commonly in India we are using atorvastatin and rosuvastatin. In the West, simvastatin is also available, which is again a good drug. But the goal of treatment is that we need to bring the LDL cholesterol levels by at least 30% of the baseline. And ideally, if the patient is a high risk category, which means he might be having diabetes or kidney disease or other risk factors, smoking, etc. So we need to bring the LDL cholesterol by at least 50% of the baseline. So that is the target for treatment according to the American guidelines as well as the Indian guidelines. So these medicines are very safe, and data has shown that they help a lot in actually increasing lifespan, decreasing mortality from heart disease, as well as decreasing a lot of comorbidities. Other than medicines, what I would like to just suggest is you need to take a very proper care of your diet and do rigorously physical exercise. I think more of that at a later date. I'd like to sign off here. Thank you, everyone. Namaskar.